let's talk about something that is, without a doubt, one of the scariest things you can experience as a dog owner. Seeing your dog have a seizure can make you feel completely and utterly helpless. But here's the thing, you're not. And today, we're going to turn that fear into a clear, actionable plan to help your best friend. We're going to start by really understanding what's happening inside your dog's brain. Then we'll walk through immediate first aid, figure out exactly when you need to call the vet, look at what long-term life looks like, and we'll finish up with some really exciting science about how nutrition can make a difference. So, first things first, what even is a seizure? To take away some of its power, we have to understand what we're dealing with. And that feeling, it's completely normal. An emotional earthquake is the perfect way to describe it. It's so sudden, it can look violent, and it's just plain scary. But your knowledge and your ability to stay calm are honestly the most important tools you have in that moment.
Here's a way to picture what's going on. Imagine your dog's brain is like a perfectly organized city with traffic lights directing all the electrical signals. Well, during a seizure, it's like every single one of those lights turns green at the exact same time. It creates this massive, chaotic traffic jam of electrical signals. That's the storm.
And it's so important to hear this. For most dogs, this isn't caused by anything you did or didn't do. The most common culprit is something called idiopathic epilepsy, which basically means it's an inherited medical condition. And the good news in all of this, it is manageable. Okay, so the storm has hit. What's your job? It's not about stopping the seizure. You can't. Your job is to be a loving bodyguard and keep your dog safe until it passes. And there are 3 simple steps to help you do just that. These are your 3 C's. They're simple, they're easy to remember, and they will absolutely guide you through the chaos. Your calm energy is the anchor your dog needs, even if they aren't aware of it. All right, let's get super practical. If they're on a couch or bed, gently guide them to the floor. Start moving things away, pull back the coffee table, get rid of anything with a sharp corner, dim the lights, turn off the TV, just lower the stimulation. And this is critical. Pull out your phone and hit the stopwatch. How long this seizure lasts is probably the single most important piece of information you can give your vet. I really need to stress this one. There is a very persistent myth that a dog or a person can swallow their tongue during a seizure. They can't. It's physically impossible. What they can do is bite down with incredible force, and they have no control over it. Putting your hands or anything else in their mouth is a surefire way to get you or your dog seriously injured. Please, keep your hands away from their mouth. Okay, the seizure has ended. Your heart is probably still racing. You take a deep breath. Now what? Your next move is determined by what just happened. This recovery period is totally normal. It's called the post-ictal phase. Your dog might pace around, seem like they can't see, or even act like they don't recognize you. They're okay. Their brain is basically rebooting. Your job is to just give them some space in a safe, quiet room and be that calm, reassuring presence while they come back to themselves. Now, this is where you need to know the difference between a true emergency and something that's urgent. It is an emergency, meaning go to the vet now. If the seizure lasts for more than 5 minutes, that's a dangerous condition. It's also an emergency if they have more than one seizure in a 24-hour period. But if it was your dog's very first seizure, even if it was short, you should make an urgent call to your regular vet to get them checked out. That call to the vet is step 1. And if it leads to a diagnosis of epilepsy, well, that can feel pretty overwhelming. But I promise you, it's not an end. It's just the start of a new, manageable path forward together. One of the most important things to wrap your head around is that the goal of treatment isn't always 0 seizures. It's about finding the right balance, reducing how often they happen and how severe they are, while making sure your dog still has an amazing quality of life. And that is absolutely achievable. In this new normal, you become the most important member of your dog's care team. That means medication has to be consistent. A single missed dose can be a trigger. And keeping a seizure diary, that's your superpower. Tracking the date, time, how long it lasted, and even what was going on right before. Was there a thunderstorm? Did you have company over? All of that data helps your vet see patterns and fine-tune the treatment plan. Now, beyond all the vet visits and medications, there's a really fascinating and hopeful area that gives you even more control. And it starts right in your dog's food bowl. So, can it? Can what you feed your dog actually help? This is kind of a game-changing question. For a long time, we didn't really have a clear answer. But some amazing new research is showing that, yes, what you put in their bowl can have a direct impact on the electrical activity in their brain. Okay, let's break this down real quick. The brain's #1 fuel source is glucose, sugar. But in an epileptic brain, the ability to use that fuel gets disrupted. This can create an energy shortage, which might make the brain more likely to have one of those electrical storms.
So, what's the workaround? It turns out to be a special kind of fat called medium-chain triglycerides, or MCTs. Your dog's body can convert these MCTs into an alternate fuel source called ketones. And you can think of ketones like a VIP fuel that has a special all-access pass. It can get into the brain, bypass that blocked glucose pathway, and deliver the energy it's starving for.
And this isn't just some cool theory. A huge study looked at dogs whose seizures weren't being well controlled by medication. When they were switched to a diet that was enriched with these MCTs, more than 2/3 of them showed significant improvement. That is a massive deal. And what's even crazier is that for some of the dogs in the study, the positive changes were seen almost immediately, like as early as day one. This is a powerful science-backed tool you can talk about with your vet as part of your dog's overall plan. So we've gone from the total chaos of the moment to the real hope of long-term management. But knowledge is only powerful if you actually use it. So my question to you is this. Look around your home right now. What's one small thing you can do today? Maybe move a sharp-cornered table or put a rug on a slippery floor to make that space just a little bit safer for your dog. Taking that one small action, that's the first step in your new plan.